after the invasive procedure comes the post-operative care, and especially the role of medicines in blood blood thinners, and how do you mitigate the complications that may occur due to blood thinners. I'm referring to their association with like preventing strokes or internal bleeding complications associated with them. Could you tell us a bit more about that?
That's a very good point. See, as I said, once you use a stent and it is a foreign material, and your body will react to it, and it can form a clot within the stent. So, which is why we use blood thinners, so aspirin, clopidogrel, or ticagrelor, or prasugrel. These are some of the antiplatelet therapy. What it does is it blinds the platelets to the stent, so that the platelets will not see the stent, and then hence don't form the clot. Now, these medications are given for a minimum of 6 months or even up to a year, sometimes even beyond a year, especially if you've undertaken a very complex angioplasty. So certainly once you go on these medications, it increases the risk of bleeding, especially elderly patients or if they have pre-existing bleeding conditions. So it's very important how do you select these patients, which is why I was saying medical therapy still has a role. So a lot of patients, you can just manage medically. Patient compliance is very important. There's no point you doing a great job and patients don't take the tablets and then stents will block, and or if they develop any bleeding problems. So these are the precautions we tell patients about. Once you have a stent, you have to be on blood thinner so they understand it. And it's a balance. In some patients, we stop at 6 months because they are at a high risk of bleeding. In some patients, we go beyond a year. If they're young patients, if they have had a complex procedure, in fact, I've given it more than a year. Yes, there are risks with the bleeding. But at the same time, if you don't take it, then you risk stent thrombosis, which is very fatal. 30% of patients with stent thrombosis die.